Hello, my name is Mark Emianto. Today I'm going to be performing the final head to toe assessment from Seneca College. This is my ID. Okay, before I begin, I'm going to do a 360 degree scan around the room. Okay, so next I'm going to be performing an hygiene. I'm going to be putting on my clean gloves. So I'm going to be cleaning my stethoscope. Okay. Please, can I see your name identification to confirm your name and date of birth and your age?
My name is William Everton. My date of birth is August 31st, 1932, and I'm 92 years old.
Good, Mr. Overton. My name is Mark Emianto. I'm here today to perform head-to-toe assessment on you. Is that okay?
Yes.
Okay. So right now, I'm going to provide some privacy for my patient. Okay, and I'm also going to ensure my patient's safety. Okay, Mr. Overton, do you need to use the washroom before we begin?
No, thank you.
Okay, good. So I'm going straight ahead with the general survey. So looking at my patient's appearance, color of the skin is evenly distributed. There's no abnormality. There's no position or lesion or masses. The skin is matches the color of the skin matches the genetic background. Okay, so there's no body odor. The personal hygiene is intact. So for his body structure, please can you stand up for me? Okay, sit down please. So for his height and stature matches his age, and there's no form of deformity, and he's able to maintain a good eye contact. His speech is intact. Okay, his speech is intact. So and is able to sit for his behavior. Is able to sit upright, and his facial expression, it looks good. His posture looks good. So and for his works of breathing, he's breathing effortlessly without any sign of distress or a shortness of breath. For his level of consciousness, he looks awake and alert, and he looks oriented. I'm going to test his level of consciousness. Please, can you tell me your name again?
My name is William Everton.
Good. Can you tell me where you are right now?
I'm in the hospital.
Can you tell me the month we are in?
We're in the month of March.
Good. My patient is alert and oriented, 3 times to person, place, and time. So now I'm going to be inspecting my patient's head and facial structure. Okay. His head has the normal cephalic shape. Is symmetrical. The color of his skin is equally distributed. There's no abnormal position or involuntary movement. There's no edema. So, and I'm going to be testing my patient for cranial nerve 7, which is the facial nerve. Okay, please can you smile for me? Can you smile with your teeth open, please? Can you frown for me? Can you raise your eyebrow? Can you shut your eyes tight? I'm going to open against resistance. Try not let me open. Good. Can you pop out your cheek? Okay, I'm going to push them against resistance and let me push them. Okay, good. So my patient is able to perform the cranial nerve 7 test, which shows that his cranial nerve 7 is intact. So now I'm going to be testing inspecting my patient's ear. So my patient's ear is symmetrical. It has the shape of the ear is appropriate for his stature. Okay, there's no discoloration on the ear. There's no pus or abnormality. So I'm going to be checking for cerumen or any drainage or discharge. There's no cerumen, and there's no discharge, and the ears are both symmetrical. So now I'm going to be inspecting my patient's eyes. So my patient's eyebrow, eyelid, and eyelashes are symmetrical. The hair is equally distributed on both the eyebrows, and the hair is also equally distributed on the eyelashes, both on the upper and the lower eyelashes. The eyelid, there's no lead lag, and the sclera looks white. The conjunctiva, let me check the conjunctiva. conjunctiva is pinkish red with appropriate blood vessel. So now I'm going to test my patient's cranial nerve 3, which is the ocular motor nerve. Okay, I will check the size of your pupil first. The size of the pupil is 4 millimeter in diameter. The pupils are round and symmetrical. So I'm going to test my patient's direct and consensual light pupil reflex. Okay, direct, consensual, direct, consensual. Okay, upon testing my patient's direct and consensual pupil reflex, the pupil was able to constrict. So the direct and consensual pupil reflex is intact. I'm going to test him for accommodation. Okay, can you look at the tip of my pen? Okay, I'm going to bring close to you, to your eyes. Okay, good. So my patient's accommodation pupil was able to constrict as the object went close to his eyes and converge as it goes further. That shows my patient's pupil is reactive to light and accommodation. So cranial nerve 3 is intact. So now I'm going to be inspecting my patient's nose. The nose is in the midline. The shape is appropriate for his stature. There's no deformity. The color is well distributed on the nose. So I'm going to check for the sinuses. For sinuses, there's no flare, there's no crusty, there's no discharge. So the sinus is good. So now I'm going to assess my patient's mouth and pharynx. The mouth is symmetrical. The lips, the color of the lip is light pink, which is appropriate for his genetic background, and there's no deformity. Okay, there's no dryness or dehydration. Okay, so I'm going to be testing my patient's cranial nerve 9 and 10. Cranial nerve 9, which is the glossopharyngeal nerves, and cranial nerve 10, which is the vagus nerve. Please, Mr. Overty, I'll need to open your mouth and stick out your tongue. If I say go, you say ha. Okay, go. Ha. Good. So my patient's soft palate and uvula rises up as I said ha. That shows my patient's cranial nerve 9 and 10 is intact. So I'm going to test my patient for cranial nerve 12. Okay, so Mr. Overty, I'll still need to open your mouth again and stick out your tongue. Good. Can you move them side to side? Good. Can you say light, tight dynamite?
Light, tight dynamite.
Okay, my patient was able to move his tongue out, and his tongue is in a straight line. He was able to move them side to side and able to say light, tight dynamite without any tremors. So my patient cranial nerve 12 is intact. So now I'm going to be inspecting my patient's neck. So I can look, the neck is symmetrical. They're in the midline, they are straight. So there's no abnormal pulsation, there's no involuntary movement, there's no lumps or bumps, there's no leisure or masses. So I'm going to be palpating. Okay, tell me if you feel any pain or discomfort. Any pain?
No.
Okay, I'm going to also test for temperature. So the temperature is 1 touch. Upon palpation, there's no tenderness, there's no rigidity, there's no lumps or bumps. Okay, so I'm going to be locating the trachea. So trachea is in the midline. Okay, is on top of the superior sternal notch. So and there's no trachea shifting. So right now I'm going to be palpating for the thyroid. So the thyroid, I can feel the thyroid cartilage is at the midline. They're intact. They're symmetrical. There's no obvious thyroid enlargement. Okay. So now I'm going to be palpating for the carotid pulse. Carotid pulse palpating is lateral to the thyroid cartilage. Okay. I'll count for 30 seconds. You can count the other side for 30 seconds too. So upon palpating for the carotid pulse, the rhythm is regular, the strength is 2+, the beat is 68 beats per minute, and they are both bilateral, equally bilateral. So now I'm going to be testing my patient for cranial nerve 11. So Mr. Overty, I will need you to move your face side to side. Side, the other side, good. Can you shrug your shoulder? Good. So I'm going to repeat the movement again, side to side, where I apply resistance. Okay, move. Good. Move. Good. Can you shrug your shoulder now? Okay, good. So my patient is able to move his head side to side and able to shrug his shoulder, and he was able to also and move it against resistance. Okay, that shows my patient clearance level 11 is good. So now I'm going to be inspecting my patient's upper extremities and lower extremity. First, I'll start with the upper extremity. So I can see that my patient upper extremity is symmetrical. They are equal bilateral. Okay, I can see the presence of buff muscle, and then there's no abnormal pulsation or involuntary movement or leisure or masses. So I'm going to be palpating. Let me know if you feel any pain or discomfort. Any pain or discomfort?
No.
Okay, good. Good. Temperature is warm to touch. Okay, and upon palpation, there's no tenderness, there's no lumps or bumps. Okay, and temperature is warm to touch. So, and I was able to palpate bilaterally and simultaneously. So now I'm going to be palpating the radial pulse. Okay, I'm going to palpate radial pulse bilaterally. Okay, so I'll count for 30 seconds. So upon palpating the radial pulse, the rhythm is regular, the strength is 2+, and the beat is 60 beats per minute. Okay, and they're equal bilateral. Okay, and the tongue skin is intact. Okay, so now I'm going to test for hand grip strength. Okay, can you squeeze my both hands together with apply some force? Good, good. So my patient is able to squeeze my hands together with same strength on both sides, and then the strength is strong and equal bilateral on both sides, and they are symmetrical. So I'm going to be assessing my patient lower extremity. So the lower extremity, I can see the back of muscle. I can see there's no leisure, there's no masses, there's no discoloration of skin. The hair is equally distributed. So I'm going to palpate. Let me know if you feel any pain or discomfort, please. Any pain?
No.
Good. Any pain?
No.
Okay. For temperature, is warm to touch. So, and also the moisture on the lower extremity is even on all around, and the upon palpating, there's no tenderness, there's no rigidity, there's no masses or lumps. Okay. So, and the skin tagging is intact. So now I'm going to be assessing my patient's posterior thorax. Okay, so please, I'm going to assess your thorax. Can you turn for me, please? Back, please. Thank you. So for my patient, okay, so the posterior thorax is appropriate, no discoloration, it's symmetrical, there's no lumps on bump, there's no abnormal pulsation or involuntary movement. Okay, there's no leisure, there's no scar. So I'm going to be palpating. Let me know if there is pain or discomfort, please. Is there pain or discomfort?
No.
Okay, good. They are equal, bilateral, and symmetrical. As I palpate, there's no tenderness, there's no leisure, there's no masses or bumps. Okay, so I'm going to be inspecting for chest expansion. Can you breathe in deeply? Out. Breathe in again. Out. Okay, so for chest expansion, the chest expansion is symmetrical, and then I was able to breathe in and breathe out effortlessly, and my palm was able to move aside. So now I'm going to be auscultating for sound, for breath sound. Okay, I'm going to be auscultating 12 points for breath sound. Okay, so can you breathe in for me? Exhale. Breathing. Exhale. Inhale. 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 Exhale. Good. So my patient was I was able to perform the auscultation on my patient posterior thorax, and I didn't hear any abnormal adventitious sound. I didn't hear any crackle or wheezing or stridor dance. The sound I heard is the brachiovestibular sound and the vestibular sound. So now I'm going to assess my patient's anterior thorax. Please, can you sit straight for me? As I assess my patient's anterior thorax, I'm going to be checking for his respiration. Okay, I'm going to count for 30 seconds. Okay. Okay, for my patient's respiration, the rhythm is regular. The breath is 16 breaths per minute. There's no sign of distress or shortness of breath. So now I'm going to be auscultating for the apical pulse. The apical pulse is at the mitral valve and mid clavicle line to the fifth intercostal space. Okay, so to set the landmark from the suprasternal notch to the angle of Lewis, left to the sternal border is the second intercostal space. If you count second, third, fourth to the fifth intercostal space is the mitral valve. If you line it from the mid clavicle line down to the fifth intercostal space, that's where we have the apical. That's where we have the apical pulse. Listen to apical pulse. So I'm going to listen to the apical pulse and count for 30 seconds. Okay. Okay. So I when listening to the apical pulse, I didn't hear any abnormal sound. Okay. The rhythm is regular. The strength is the rhythm is regular. So the beat is 68 beats per minute. I was able to hear the S1 and S2 sound. I didn't hear any S3 or S4 sound. So now I'm going to be inspecting my patient's abdomen. Please, Mr. Overton, I need to lie down on the bed in the supine position, please. Good. Okay. Good. So I'm going to drape my patient properly. I'm going to put the pillow behind under his nail. I'm going to drape him from top to bottom and only expose the abdominal where I'm going to be inspecting and auscultating. Okay. So first I'm going to inspect from the bedside. Okay, the contour looks flat. There's no abnormality. There's no lesion or masses. So I'm also going to inspect from the feet. Okay, the abdomen is symmetrical from the feet. Okay, good. So now I'm going to be auscultating the four quadrants, starting from the right lower quadrant. Okay, so I'm going to be listening to the vowel sound. Okay, for the right lower quadrant, right upper quadrant, left lower quadrant, left upper quadrant to the left lower quadrant. Okay, so upon listening for vowel sounds on the abdomen, I didn't hear any abnormal sound. I was able to hear the high pitch gargling and cascading sound, which is a normal sound. So now I'm going to be light palpating the four quadrants, starting from the right lower quadrant. Okay, let me know if you feel any pain or discomfort. Right lower quadrant, do you feel any pain or discomfort? No. Right upper quadrant, do you feel any pain or discomfort?
No.
Okay. Left upper quadrant, do you feel any pain or discomfort?
No.
Left lower quadrant, do you feel any pain or discomfort?
No.
Okay, good. So upon palpation, I didn't feel any tenderness, any lumps, any masses. So and my patient said he didn't feel any pain or discomfort. So I'm done with the head to toe assessment, Mr. Overton. So the doctor is coming. Please, can you see that? The doctor will be coming soon to see you. Okay, kindly wait for him for further instruction. Okay.
Right.
So I'm done with the assessment. I'm going to take off my glove.